Aloha, my name is Michelle Tom. I'm a registered nurse and a registered dietitian, and I'm currently in my second year at University of Hawaii's Doctor of Nursing Practice Family Nurse Practitioner Program. I've always had an interest in wellness through lifestyle choices. For me, it's always been, how can I come up with creative ways to help inspire and influence other people to constantly work on and improve all aspects of their lives. Chronic diseases continue to rise, but in a lot of cases, they're preventable. So after graduating from Ohio State, I moved back to Hawaii, and I've been working as a dietitian for 6 years now in both the inpatient and outpatient setting, because I believe that through education, motivation, and support, patients become inspired to make the necessary changes to lead healthier lives. And I believe that if I'm advocating for this healthy lifestyle, I better be living it. The question I then asked myself was, how can I have the broadest impact? I was born in Hawaii but grew up in Ohio, Michigan, and Japan. And while growing up, I had the opportunity to travel broadly. From these experiences, I learned about the importance of culture and diversity. In college, I had the opportunity to go on an alternative winter break trip to South Africa to evaluate HIV's impact on impoverished communities. In 2016, I had the opportunity to go on a medical mission to Vietnam, conducting nutrition presentations to local Vietnamese hospitals, doctors, and nurses. Healthcare is universal. Regardless of where you live, everyone is affected by their health. For me, I knew I not only wanted to have an impact locally, but also globally. And what I've learned is that when trying to bridge the gap between cultures, it's really important to find common ground. And for me, healthcare is that common ground.
I've been working as a registered nurse for 9 months now at Halikuike, a residential care home specializing in dementia care. I oversee and manage our patients' care, making sure any changes in health status or emergencies are addressed, and regularly communicating with families and doctors with any updates or changes in status. Alzheimer's runs in my family. My auntie and grandma actually lived at Halikuike at one point. Knowing I'm at an increased risk of Alzheimer's, I'm intentional about making the most of my time.
So this is the Aloha Free Clinic. This is the clinic that I'm at this semester for my nurse practitioner clinical rotations. And the clinic is a pop-up urgent care that was originally set up to provide free medical care to people who are newly uninsured because of the COVID pandemic. What's so amazing about this clinic is that all of the staff members, the doctors, nurses, pharmacists, nurse practitioners, social workers, they are all volunteers. So it's been a huge source of inspiration for me, as well as a privilege to learn from people who have not only dedicated their career to helping others, but have also devoted their free time to helping the community. During the next 5 years, I'll have graduated from the Nurse Practitioner Program and will have started working as a family nurse practitioner, bringing best healthcare practices combined with my nutrition background to the communities I serve. As I continue to build my practice in the next 10 years, I want to incorporate more medical missions in different parts of the world. And I also want to get my acute care nurse practitioner certification so that I can expand my sphere of influence. In 15 years, while continuing to work as a provider, I hope to share my knowledge with others invested in the healthcare field by getting involved in the academic realm. My goal is to increase global health electives paired with international clinical rotations within nurse practitioner programs to help bring awareness to global health needs and to help increase the global health workforce, ultimately bringing better healthcare across the world.
The health of our patients is paramount, but along with that is their trust and their confidence in our competence. Good health is about being fit, being able to take care of ourselves so we can best take care of others. So thank you, FIGS, for giving me the comfort and confidence I need so that I can perform at my best.